Good evening. Welcome to Chit Chat. I'm your hostess, Devondria Sanchez, licensed marriage and family therapist, also known as the Fit Therapist, owner, founder, and client of Finding Inner Transformation, where we believe the fit mindset is more than the physical. It is emotional, mental, and spiritual. So today I have our panelists, and I will have them introduce themselves, but we are going to just stress, put your comments, feedback, and questions in the chat and let us answer them. If you're watching this in a recording, still put your feedback, questions, and comments in chat. We'll make sure it gets to the appropriate party. But we are here talking about suicide prevention. And before we move forward, I'm going to have my guests introduce themselves. So I will start with Miss Jackie.
Hello. Hi, I'm Jackie Jones Siegenthaler. I'm a licensed marriage family therapist, and I'm pleased to be here. And although our topic may be one that is hard to talk about or even avoided at times, I look forward to exploring that with you all today and hopefully answer some tough questions and shine lights on dark areas and just bring it together. So I look forward to that. I've had the gift of working with the Suicide Prevention Task Force in Kings and Tulare County, and now primarily Tulare County, since 2011. So about 10 years of experience working with prevention efforts and post-prevention efforts in the wake or the loss of a loved one to suicide. So a little bit of information and some time I've spent in the field.
Thank you, Jackie. Miss Brittany.
Awesome. Thank you, Jackie. Hello, everybody. My name is Brittany Collins. I am a mental health advocate and a rehab specialist. In my mental health advocacy, I serve as a team captain under the National Alliance for Mental Illness, also known as NAMI. And I have been putting on my own walk since COVID. So my team captain, my other team captain, and I, we actually have had 2 successful mental health awareness walks. And so, yeah, I'm ready just like you are, Jackie. And Shaw?
Yeah, that's my alias. It's Devondria.
Okay.
So,
the fit therapist,
Yeah, I had the opportunity to meet Brittany this past May, actually at a NAMI walk that she hosted, and she was just on it. I think I was the first one to show up, and we just kind of connected, and I knew I wanted to reach out to her just because she was just passionate about getting it all coordinated, making sure that everyone knew that mental health is here and that we don't have to stigmatize it. We can normalize it and start with it as like, let's get out there, let's walk. And so that was just awesome. And then Miss Jackie, I have known for quite some time now. We worked together at Kings County Behavioral Health. I don't know, 8 years, easy.
2009.
Oh my gosh, 2009. And we got some Jackie lovers on the chat today, so they're shouting her down. But I wanted to get on here as people are starting to come on, just to say we have to talk about tough subjects. I think this is one of the ways that we do destigmatize. This is how we do make sure that people are aware of what is going on. And since September is Suicide Awareness Month, I know they have specific days where they really just put out that awareness, but this is the month in which we can just kind of like recognize and provide some more education, as we know it is growing in numbers. One of the things that Jackie and I were just talking about prior to coming on is and Jackie, correct me because she's my stats girl, more so, this is the second leading cause of death for 10 to 24-year-olds.
Yes. Yeah.
That is alarming to me. And I don't know about anyone else, but when I think about that, and I want to say it was about a few years back, there was a 9-year-old, like 8 or 9-year-old that had made the way across, headline news of taking their own life. And a lot of it we're watching is bullying. Do you think that I'm not saying a lot of it happening, but we're seeing more another way. we're seeing cyberbullying becoming another way to bully children and kind of put that attention out there when clearly there's some emotional anguish and pain that's going on. Jackie, you want to say anything about that age group in particular? And of course, we know that there's other things happening and developing and changing during that time when when we talk about fitting or belonging or trying hormones changing and things like that.
Well, I don't think I've ever heard or seen anyone learn that statistic and take it without shock.
Yeah.
It always is, and in fact, every time I hear that statistic or that the reality of the second leading cause of death for that age group is being suicide, it still falls on my ears as like, what? No.
Mhm.
But the reality is it is. And this a very sad part of that is that there's a great deal of preventable loss there. There's a great deal of preventable lives lost. So it's a time of incredible adjustment, developmental changes, trying on identities, all of those things. It's incredibly complicated. And then when you layer on things like, oh, I don't know, a pandemic, um,
Mhm.
the casserole becomes even more complicated. So it's a very sad but true reality of some of the lives lost to suicide.
Yeah.
The second leading cause of death for that age group.
Yeah, and we'll get into as we progress here, kind of like what some of the warning signs are or causes, and maybe hopefully clear up some myths about suicide. Because I know even growing up for myself, especially within African American community, mental health was not talked about. A lot of households, I would say in general, but when we do layer on culture and ethnicity, especially when we related to, cultures that are really heavily in the faith, we also can see where some of the stigma or just the lack of knowledge in general, And so before we go there, I want to ask Brittany just to kind of share why NAMI, why are you walking? Why are you the team? Where did this passion come from?
So that is a very, like you said, I'm very shocked to learn that is, the second leading cause of death. And it was 10 to 24, right? So my best friend actually suicided in December 2nd, 2014. And when you guys said the age group 10 to 24, I'm thinking about the age. And the last time I saw him was actually for my 23rd birthday. And he would be turning 23 about a month later. So I was like, wow, like right on the cusp. So yeah, December 2nd, 2014, changed my life forever. And it's a good thing and it's a unfortunate thing that I just had happened to pick up the passion of changing the stigma and getting the awareness out there about mental health and suicide awareness because it happened in my life, and it was something that affected me. So I was like, oh no, like this can't happen. And this is happening to, my best friend, somebody that I've grown up with, we're supposed to still be growing up together. Like, and now, that's not reality. And I was like, oh no, like I can't, this is not going to be happy. I have to do everything I can to prevent this on my watch. You know what I mean? And to, kind of piggyback on what Shaw was saying about, in the Black community, there's such a stigma about not sharing what's going on in your household and this and that. And no, it needs to be shared. Maybe not to the whole community, but to one person that has to keep confidentiality as it needs to be shared, because like all of those things that just pile up and the things that lead people to, to depression, to mental illness because of trauma. And then when they get to that end point, there's no positive in any direction. As much as they look, happy, their lives are happy, they have new babies, they're newly engaged. And, when you start to learn about suicide and you start to learn about, the thoughts and how people really plan, and after this took a while for me to think about, I had to heal and forgive. But, as you learn about it, I replay everything that happened from my birthday to December 2nd, right? Like it's my birthday, his birthday, like he got engaged on my birthday weekend. Like it was a whole little decoy thing for his fiance. It was so cute.
Brittany, when's your birthday? What month and day is yours?
Mine is September 6th. His is on Halloween.
So from September to December.
Yes.
So a little tiny bit less than 3 months there.
Exactly. So just thinking of all the things that had happened, occurred, the conversations had, like if I would have known, what I learned in my, suicide, my assist training, like I could have been like, maybe like I could have prevented something, like something could have happened, and I don't blame myself, but it's just like, man. And that's why I say it's unfortunate that something had to happen in my life to where I'm like, oh, my mind is open to mental health. Like, oh, duh, we have to take care of our brain just like we take care of our body. Like
but how many people think that same way, right? Like I could have done something, or if there's more. And I think it is how you started off saying it's good and sad at the same time, right? There's these two emotions kind of running simultaneously for one event, because now you're aware that it can happen to young African-American males, to include people close to you. Like it no longer seems so far-fetched, right? And I know part of the reason why I'm doing this as well is from my own testimony of my stepfather, who died by suicide, and at a very young time, because now my husband and I are around the age, that happened. And, when you're younger, you're like, oh my gosh, he was older. And actually not. And I think it's more common, and we're kind of picking on African-American men, but I think there's something to be said about that, because for so long it seemed like it was older white men. And even if that is the data, still we're recognizing more cultures and ethnicities that this is believed to be a viable option to take away pain. Right. So even growing up, I grew up around, and this is my first time really sharing this openly. Some people know is he would do attempts throughout my life, and there was no end to where he would do it. It would, whether it was pills, whether it was a food processor blade, whether it was how he eventually overdosed intentionally by pills and drugs together. And it was the day after my wedding. And so it's marked, it's printed. I recognize that. But what I did not know growing up, but I know now, is that he was suffering and struggling in darkness. And there was nothing that we could do. And this is why I can kind of relate, Brittany. Like I thought about, well, if I would have let him go to the wedding, right? If I would have let him do these things, I'm wondering if that would have changed something. But he had been dealing with this pretty much all throughout my life. And so, so my cousin, actually, she remembers that day, and again, I didn't know about mental health because we didn't talk about it. It was one of those things that we don't talk about, right? Is that very common, Jackie, just even working on the task force?
Yeah. And even in the moments of in loss and after loss, so I'll share a little bit. one of the things I do with the task force is I'm a member on the LOSS team, and that's an acronym for local outreach to survivors of suicide. And when you've lost a loved one to suicide, you are referred to as a survivor in our field. So we are trained under Dr. Frank Campbell's LOSS team creation, and it is his research proves that the sooner you reach out to a family, sooner, as close as you can to the time of loss, the time of death, the better. And for recovery, additional loss, all the other things that our minds start to kind of wander through. Both of you have just literally hit on the head some of the things that survivors experience, remembering dates, timelines, checking boxes, things, the shoulda, coulda, wouldas. Dr. Frank calls it, you start shoulding on yourself. So what we do though in that moment is literally go to the door and look in the face of loved ones who are newly bereaved to losing their loved one. And never, ever, and of the times that I have been to people's homes, unless it's pretty severe mental illness, no one is ever in a place of almost everyone. You could tell them the aliens came down from the sky in a spaceship and did this before they could really wrap their minds around their loved one taking their lives. So it's just, it doesn't matter what the history or experience is. No one really is prepared for that type of sudden and traumatic loss.
Yeah, and one of the things that I love that you mentioned, and I'm sure, Brittany, maybe this kind of snowballs into your field of practice too, is the sooner the better we can get those survivors, because we want them to keep some of that normal activity even during the tough times. And, you know, Jackie, you said when your mind starts wandering, and I can remember some of that with my mom, right? I mean, as a kid, well, I wasn't a kid, I was an adult. I just got married, but I still was very immature to mental health.
Right.
I had not, I had went to undergrad for sociology, but nobody prepares you for this, right? They don't, we're learning terms, right? We're not really dealing with, real life situations. And so I had no understanding of really what bipolar disorder meant. I had no real understanding of childhood trauma, which he had went through. I just knew he was making my life chaotic as a kid.
Right.
Because he was chaotic, and then he had a substance use. So all of kind of like some of the check boxes, we'll all go through, because I'm sure we see it, some of the warning signs of substance abuse or use, right? Disorder gets in the way. It can kind of like push if you're having those thoughts or ideas a little bit more. It doesn't mean totally, but it can play a factor. And that's what I think the tricky part is about suicide, is there's no outline. I mean, you have some stuff that could be risk factors, right? Jackie, just always correct me if I'm going left, but there's some risk factors, but there's no clean sheet.
No, so that is tricky. Suicide can hide. Suicide risk can hide in plain sight, right? So, and the one of the biggest, and however you want to guide the way I'll follow however we go with this, but this is a perfect kind of section to bring this in. That one of the greatest myths of suicide prevention and talking about suicide prevention and awareness, one of the kind of biggest roadblocks or barriers to open dialogue in suicide is the fear that if I ask someone if they are having suicidal thoughts or if they have thought about killing themselves, and the more specific and the more kind of like blunt you can be about with where you're getting at, instead of like the avoiding with, have you ever, do you ever think about harming yourself? Because if you can just go straight in with have you ever thought about suicide or thought about killing yourself? There's a huge overarching myth that if we say it first as the concerned loved one or the concerned friend or coworker or whatever the relationship dynamic may be, that we then are planting the idea in the person's mind that we're already concerned about. So we're concerned about someone. I certainly don't want to say something that could increase risk, right? The reality is, and that's one of the biggest messages, if we could ever just really drive that home, is you aren't giving somebody the idea. You aren't. The reality is the idea has been there and the thoughts have been there, and thoughts are actually quite normal. Thoughts are normal. It starts to become different, concerning, high risk when thoughts turn into plans. When thoughts have plans, and then access to means, and means, those means is the term we use for whatever the method someone may be considering to use. If you have access to that method, a plan, and thoughts, that's like all the ingredients to some pretty, very serious risk. So a big myth that is, the silence of stigma is we just don't talk about it then, because out of fear, I don't want to give somebody that idea. The reality is you're not.
That's good.
Yeah, because you have to directly ask them that question, because it does two things. One, they're either gonna say, yeah, I plan to do this, this, and this. Okay, well, now you can go and get a safety plan together.
Right.
Let me get whatever the means are. Let me go get all of that. Make sure that's out of the house, out of wherever. Or two, the person's gonna be like, well, I don't know. I've just kind of been thinking about it. So then, boom, then you can put that intervention in there, So I definitely agree with getting that myth like silenced.
Yeah.
It's just not good. And I also wanted to touch on something that you were saying too, Shaw, about the substance. That played a huge part in my friend's suicide. It was actually ruled an accidental suicide because he was so high on meth, which none of us even had a freaking clue. Not no clue.
Right.
Like what? You're what? You know what I mean? And so, how Jackie, you were saying like those thoughts, right? They can start to become actions when substance abuse is all plays a part. And then it's like what you're thinking in your head that's like way out of here is like, no, it's right here. Let me just go do it.
Yeah. And because it's not always up in our face. And a lot of times, people that are really in pain and anguish are isolating or having some of this internal dialogue going on that we know nothing about. Right. I want to stop real quick and read. I want to read Trina's question. A lot of people do not take the time to educate themselves before judging. It's a struggle every day, and my own family may say it's just drama or for attention. And so someone said, I hope you get educated. Right. If I don't know something, sometimes it could be out of fear that the family's saying is drama. Because what would happen if I really knew the answer, or what would happen if I really did think that was the case?
Or told the truth. About
exactly.
Happened.
Told the truth. Or again, the judgment part is what sometimes can be difficult for many people to even come forward and share, just express themselves in regular feelings. Right, Jack?
Right. And it's kind of it goes back into the stigma can perpetuate through those things. It's much easier for me to say drama or all the other things than it is for me to get right to the heart of the matter and face this. And then what do we do? And it's not just loved ones either that struggle with really like facing this with like assertive action, right? I don't want to use the word confront it, but even professionals kind of can experience, I do, and I know my colleagues and coworkers, a little bit of a pause and like a breath, kind of a little bit of a sting when an assessment or a person or a client goes there, because there's this instant human response, human nature response. It doesn't matter if you're, 20 years deep clinician or frustrated mama with a teenager with a foul mouth. We want to fix, right? We have an urge to fix. And sometimes in the face of a person sharing pain or their thoughts, just sitting in the discomfort, just sitting and hearing it is so valuable for the person experiencing it, because the response to, no, don't stop, let's fix this, as well-meaning as it may be in the moment, really doesn't affirm much for the person expressing that sort of discomfort.
Right.
So we got to model it too. So when we're brave enough to ask it, we also kind of need to model that I can sit in this discomfort because I'm asking you to sit in yours. I'm asking you to stay with us. I'm asking you to keep fighting this fight in your discomfort. So I'm going to sit in mine.
Right.
With hearing those words. So it's almost a moment to model back to to the person.
That's so good, because we know any clinical case management, whatever role we play within the mental health field, I don't know many clinicians who've been in longer than 5 years who've not had someone said suicidal ideations or having to dig deep of what depression really means to them, and to ask that question straight up. And I want to briefly say that and then ask this other question, because having doing kind of like self-injury is very different from suicide. So when Jackie is saying you need to be direct and ask the question to a loved one or someone who is sitting in your presence, we need to be specific, because someone who decides to self-injure may not be thinking about dying. It be opposed. They want to get rid of that immediate pain, which is very different from someone says, I want to end the pain by no longer being here on this earth. And so we want to distinguish between the two, because one does not mean the other. And I know it's tricky, especially for a lot of younger people who choose to self-injure, although I have encountered much older who have been doing it for years, having, cutting behavior or burning behavior and doing things to kind of get rid of that emotional pain, because it's better than feeling what I'm feeling right now. I'd rather feel that physical pain. And sometimes it can come, a rush after a while, for someone who is trying to eliminate that emotional pain by way of self-injury. So we want to distinguish between the two. And yes, it may feel uncomfortable to ask someone, do you feel like dying? Do you want to die? Do you have a means of dying? Do you have a plan? Who is available for you to talk to when you leave here, and creating, like Brittany said, that safety plan. So I think all those are important. So can poor diets contribute to unhealthy mental health? Yeah.
He said
can poor diets contribute to unhealthy mental health? Well, there's a lot more research being out there right now about inflammation of the body, right? And inflammation of the brain. And some foods are inflammatory. So I had read Dr. Leslie Korn, who I love, she's a integrative mental health clinician as well as a psychologist. And she said, one of the worst things you can do and I don't want to get off sidetrack, but this will tie in, is give a veteran coming back from war a poor diet, because they're already inflamed in their body by way of stress, trauma, assuming that was their experience. And then to take in a really highly processed food diet that just kind of like inflames our brains and our bodies. And it just can be very toxic on two levels, right? On two fronts. Yeah. So yes, an unhealthy diet. However, I can also say a very clean diet, and you define that, doesn't mean you cannot have mental health issues. So I want to definitely debunk the myth that one causes the other. It's almost like, you didn't fail because you had a Big Mac, just like you're not healthy because you had one salad. So, but we are paying a lot more attention of inflammation in the body, by way of foods. And for those who are very into holistic healing, look at that. Because if someone is, let's say someone is suicidal, I would take a look at what they're eating. And actually, I make that a big part of what I assess. Are they hydrating? Are they eating properly? Are they sleeping properly? What is their
sleep
diet?
hygiene.
Yes, because we can kind of add to that some folks are not getting sleep. I heard a story of a guy who attempted and did not get a chance to, he was unsuccessful, thank you. But he hadn't slept for 2 weeks and his dad didn't know. For 2 weeks. And when it's kind of like what Jackie was starting to say, when his dad asked him, he said, "I just don't feel like being here." The dad did not have the courage to follow up and ask that question, or didn't know. And so he told his dad, "Oh no, Dad, I'm just BSing you. I just need to get sleep." Because Dad said, "Well, I think we should go to the ER." At that point, so I'm going to ask both of you, at that point in that scenario, what should Dad have done? The son says, and this was like young adolescent, like 18, 19, so adult, and he says, "Dad, I just don't want to be here anymore," after they had gotten into arguments. And Dad said, "Well, I think we should go to the hospital." And the son says, "I'm just BSing you, Dad. I just need to go to sleep." And Dad said, "I still didn't feel comfortable, but I did nothing." What should Dad have done in that case, Jackie and Brittany?
I would say go, and maybe if he could have responded differently, to avoid that argument, maybe he could have said, "Okay, where do you want to go?"
Mm-hmm.
And really, get more clarity about what he's doing. And then when he says like, "Okay, well, like, let's go to the doctor and like, let's just to make sure you're okay." Like, don't make it seem like, "Oh my gosh, something's wrong." And, like, just normalize, like we're just going to get a checkup.
Cool. Yeah.
A little more casual.
Yes, we're just going to get a checkup, and even after he said, it's kind of hard because like an 18, 19-year-old, like if they don't want to go, they might not go. So, I mean, I might have called somebody to the house.
Yeah.
And Brittany, you are like vocalizing every parent of a young adult's fear, frustration, and kind of situation, really. So, after the son said that would have been a moment too for Dad to say directly, to ask about suicide, and if son's having thoughts of suicide. That could have been that moment right there, because it's those kind of vague statements that our loved ones at risk will kind of, they almost give invitations
Mm-hmm.
for folks to pay attention and offer sentiment and care. I always remember Kevin Hines, he's a grown adult now, but he's known for his motivational speaking and his books and his story on his very, very, very serious suicide attempt. He survived. He jumped off the Golden Gate Bridge.
Mm-hmm.
He survived his attempt, and in his story, he tells, and it's painful. He tells how he can remember that day taking the bus, walking to the bridge with his decision, and he describes himself as very visibly emotionally, rocked. He's all the things we think about: crying, the hyperventilating, the deep expression of sadness and pain. And he tells in his experience that if just one person asks me if I'm okay, or something, is what's wrong, or just one person, that's that's my sign. I'm gonna, it always gets me, but he tells that he's, rides the bus, nobody says anything, or he gets there, finally gets to the bridge, he's walking, and then somebody stops him, and he's thinking, oh, okay, someone stopped, and they say, "Excuse me, would you take a picture for us?" And he's in that state.
Wow.
And it's just like, oh man. So there's invitations. They're invitations sent. Now, does that mean we are to be harsh on ourselves, or to be detectives for our loved ones' invitations all day? No.
Mhm.
We cannot scour through the timelines of that we share with our loved ones that are lost to suicide, or become detectives for our loved ones around us now that we're concerned about. It's not, it's that's also an unfair, unrealistic expectation of you as well. So it's just important to become empowered with knowledge. It doesn't mean that you have, that's your hat you wear every day, but that now you have an understanding. It's just like the same thing you would do for your loved one if you noticed they were drinking more than you thought was healthy for them, or if they are making poor physical health decisions, things like it, all those other things that we're pretty knowledgeable on. We're just trying
Yeah.
to increase knowledge on this now.
And, there's a couple points. One is I was sharing with Jackie that I had read in 2019, there was over 700,000 deaths by way of suicide in 2019.
700,000.
That
700,000.
that
I
and,
didn't think you were going to say thousand.
and I was listening to something that said, you know what? I didn't even worldwide, right? I mean, this is not just here in the US, but they said other countries had come down between, I think it was 2002 to 2019, but America, United States went up. And I'm just thinking, what is going on? And then it makes me think of, and I want us all to kind of chime in on this notion, because it's so unfair when people say it's selfish when someone takes their own life.
Right.
And
when you
that's
speak to, it's harsh. And when you speak to survivors of loss and loved ones of loss, that is a very painful way to have one's death referenced as selfish.
And so it's because we're here on the other side of the dirt, right? That we can say and judge, and because our life is not on that road at that moment, right? Because none of us know anything, right? So it's almost this judgment still, like, well, or they'll say, well, what happened? They seem so happy, or I gave them everything. And I think that was what was going on with my own mother. She put them in the most expensive rehab. She go to these different meetings. I remember I didn't really understand what was going on because I was young. I just know things were happening. And even though they were normalized for my family, I knew something wasn't right. It's not right for someone to want to jump out a 2-story duplex, right? Like that can't be right. And, my brother having to get him down, a almost 300-pound man out the window, or someone foaming at the mouth because they and didn't know what was going on. And this was like part of a regular notion where I live, which I know now, in hypervigilance. Like I lived on the edge and did not know. So a noise, when he came in, it was kind of like, what's going on? What's tonight's late night show going to look like? Right. Yeah. I can sit here now and talk about it in that way. But as a kid, your brain's just trying to make sense of what's going on. And when you're absent from information, you started doing your own interpretation. So it looked like, you use words like crazy, use words like he's just trying to make our life hell, because that's what I thought, not knowing he had been suffering from mental illness. And then we would see my mom do these extreme efforts to kind of like love on him and get him to understand and buy him things and do things. And we couldn't understand. It's like, just be done, right? I mean, we didn't understand it. But she had a piece of information of mental health that we didn't. And this is why talking about it with youngsters, especially with that opening statistic we started with as young as 10 and even 8 and 9-year-olds, we're never too young to kind of have this conversation. I remember when my kids were probably 8 and 10, and we had the conversation about suicide, and they know about my stepfather, who they didn't have the chance to meet. But I talked about those things in a way where I'm not impacted like, I was coming up. So it was healthy to talk about it. And I said, when you're a friend, friends keep secrets sometimes, right? So like a secret might be, I got to crush on Johnny. But let me tell you what's not a secret to keep. What's not a good friend is if a friend says they want to hurt themselves, kill themselves, they no longer want to be here, you do not keep that. And I think for parents that are scared to kind of have that conversation, you can very much so, there's so much out there on YouTube. I mean, when we were coming up, I mean, Brittany's a little younger and Jackie's definitely younger than me. But we didn't have that access.
No.
But the access they have now can be to hurt or to harm. But we can use it to help and empower as well, right? We can use YouTube how to talk to kids about suicide, how to, and in their age of development, and then have a general conversation. And I think that's so important. So I started off with about the selfish thinking is because we're uneducated about how to even have this conversation. But the younger we have it, the more impactful, right?
Right. I remember Dr. Campbell always used to say there was no no one came to the people he was working with, to their doors with the casserole. You know, when you lose a loved one to car accident or illness or just about any other sudden or traumatic loss, there's an outpouring of love and support.
Yeah.
And with suicide, it just looks different. There's such stigma, and it's perpetuated through silence. And even, Brittany, your experience that when you share how your friend's death was even ruled accidental, that's even I cannot tell you how many times I've heard or learned or been in trainings where that is a systemic issue, because even in death rulings, suicide has additional loss with that. So up to including how families' insurances respond, up to and including how certain faith communities respond to that. So it's old school. It's rooted in some real life, responses to this way of losing someone. And even our coroners, I've been to trainings and conferences where coroners stress and share their hearts on. It's almost like if there's any wiggle room of a doubt there, the loved ones and the family members and insurance people and the funeral homes, and the list is long, to save that family any bit of harm, that additional harm that could come to it, even though the coroner knows but if there's a wiggle room of doubt, how often that a ruling on a death certificate will not just be as simple as we think, even though it was,
Yeah. Jackie hit on layers. I want to throw that. The first part of it is the stigma and the outpour, because Brittany, how many people you say was at your NAMI walk that you did in May that we were at?
Maybe about 30 to 40.
Okay. Now, if you would have went to the cancer walk, the AIDS walk, they are droves.
Right.
There are droves. And I say that, and there used to be a time that AIDS was like taboo. Now people are walking, they got shirts, we're doing it, and we still do not see that for mental health. And there's no reason with that statistic. And what is it? Mental health 1 in 4? Is it 1 in 4? 5? We know it's probably like 1 in 2. Okay. Yeah. But I think it's hitting somewhere around 1 in 4. But depending on what site you go to, say maybe 1 in 5. But with that being said, why was there only 30 people in Fresno? Fresno being the third largest, fourth biggest city in California? 30 people.
Brittany, did you do this in May too as a mental health awareness? Yes, I did this in May.
That's even softer, more gentler than
we
suicide.
We were one of the top teams in donations. I promote a month out. We have our own team T-shirts. We have a location that we're at. And it was really just because NAMI was doing, walk your own way because of COVID. So they weren't having their big event.
Yeah.
You know what I'm saying? So I'm like, well, no, we're not just going to cancel because like people out here have COVID and they're in isolation, and that's messing with their mental. So I want them, while they're driving to the store, to see people out here that are thinking about what they're going through.
Yeah. And like you said, Jack, that was another layer because it's mental health, which is kind of growing a little bit better. But now we isolated and being very specific to suicide prevention. I didn't even hear of any. Well, maybe I seen one thing on Facebook, but you're right.
Yeah. So NAMI is our National Alliance for Mental Illness. And there's regional chapters. Brittany, you can speak on this if I butcher this. So NAMI is to mental health in general, like AFSP, and that's the American Foundation for Suicide Prevention. That's kind of the national group for suicide prevention. And historically, they also held walks, each region. And they were called, and you know, you guys may be familiar with this, and people watching may be familiar, but they were the Walk Out of Darkness. Do you remember those? And I might even be messing that up as well, but that's a kind of another example of getting people together. I do think, Brittany, though, that's good work that you did, and I think COVID's just a weird year. I don't even know if you can really, you know, it's almost like,
you know, it was.
You almost have to celebrate that 40
in COVID. You know, I think in like our first year when it was May 2020, we had a little bit more of a turnout, but you know, then it was like a whole year, and now everybody's like, I don't know. So, you know, I do wish that there was more people that felt like, you know what, let me take 2 hours out of my day, go get some exercise, one. Okay, because that's going to help my mental health, right? That's going to release all those good endorphins and all that stuff. And two, let me go do that for a good cause. If it's not for anybody else, let me just do it for me, because I want to make sure that I take the time to get a mental health check, physical, whatever it may be, you know. And the reason that I am a mental health rehab specialist and I do work with children is because I feel like the younger that we learn these skills, and they're really EQ skills, emotional intelligence skills, you know, and I think school districts are starting to catch on. I definitely know Fresno Unified is starting to teach whole brain teaching, and they have implemented EQ, emotional intelligence, but it needs to be overall, not just for kids who, you know, are disciplinary problem.
Right.
You know what I mean? It needs to be like a class,
everybody,
like PE, right? To learn like self-awareness, to learn where you feel anger, where you feel hurt, why you feel it, how to express it, all of those things, you know what I mean? So that when you get to high school, or even if it's before, or maybe if it's college, and you're like, man, like, you know what, I think I really just need to go see a therapist. And you just go and you call and you make the appointment, just like you make the appointment to go see a doctor.
Yes,
like that's my vision, and that's why, you know, it's my passion. I work so hard to like really change the stigma, because it's like, just how Jackie, you were saying, there's a stigma when they're like ruling the deaths because of all of the other things that has like the trickle effect,
all of that stuff.
It's just like, dude, we have to treat mental health just like we treat physical health.
And it's a component of it. Like the brain, the head is not disconnected from the body, right? I mean, I can't take this off the shelf. Like, I don't do that at night. Like, it's all in one, and one impacts the other. You know, even if you have physical pain in your body, you know, it's going to impact your mental health. And so, again, Jackie made another great point about the financial piece of it. You know, not being able to get insurance, and you know, certain mental health diagnoses. You can't carry a firearm, or you can't do this, and so we see these
really discrimination.
Yeah, well, and we know that the way the insurance companies and things like that operate, they're operating from a business standpoint, not necessarily a caring openness. And I'm not saying all, but I'm saying that's kind of like the theme here, right? Just like mental health, it's still a business. I hate to say it. And sometimes people will ask, well, how much is it for a copay, or can you afford it or not afford it? If you have a high copay, or let's say you have no insurance and go to private practice, expect to pay anywhere from 100 to 250.
Yeah.
People can't afford that every week. So then
I said for 50 minutes that go
for
by
50
like that once you get in there,
For 50 minutes, and some of these diagnoses requires a little bit more longer term than, say, someone coming in just because they're stressed about a test, right? And so that could look like a barrier. I want to kind of go through a few of these checklists, and then start making our way to try to wrap up with some resources if possible. But some of these risk factors, Jackie, just coming from your experience on the loss team, it's not okay. So there are some diagnoses that are more, that they will say is more prone, that you need to be a little more careful of, right? Even though that is not solidified to mean that you are suicidal. So from my experience and from what I've heard professionally, is bipolar disorder, some major depression, post-traumatic stress disorder, schizophrenia. But we know there are people who've had no diagnosis, such as some of these 10, 11, and 12-year-olds. They haven't even made their way. And so we can just say someone who could be thinking irrational at the moment. Right? Is there any of those diagnoses you would kind of like say are off the table or not? But we know we can't say it's just because of that.
Right. No, and I would also, at the respect of not generalizing, right? I do want to say there's no generalizing at all. And I would also like to also pay attention to borderline personality disorder diagnosis, the symptomology. And what you'll see in a lot of the symptomology of the diagnoses we just discussed is that reduced impulse control, increased emotional responses, right? So being emotional is not negative. That's not a negative thing, but culturally, in Western culture, and I'm talking like and now I'm going to get general. Okay. I'm talking Western culture, whether you just got here yesterday or you're a third generation, you can see I got a Jones in my name. Okay. I'm just going to tell you now.
Yes.
In Western culture, we're not about being emotional, and we are not about waving a white flag when we need help. And we are not about letting somebody know that we might be struggling.
Sure.
So when you add those cultural, and that's something that we do, just looking at our three faces here, all of our families share that value. It does not matter what, that's just Western culture straight up. So when you add those things into then the general symptomology of some of these mental health diagnoses we're talking about that people are experiencing, you will see increases in behaviors like suicide attempt behaviors and suicide risk in general.
Yeah.
It's important for those things.
Yeah. Thank you for just kind of covering that, because even though we'll hear professionals kind of like say, these are things we really need to look for in these diagnoses, we know that you could have zero diagnoses. And I want to put that out there, because some little kiddos don't even make it there, right? And some of our just even adults don't make it into treatment. I mean, I think it's over half don't even seek treatment. And so we can't even really blame it on that. We can't.
No, you can also be a billionaire too. People always suspect that, if you just with access to resources or money, that's also you can just go do a quick Google of that. That's a skill that, suicide is an interesting and complex reality that hides in plain sight.
Yeah. And then sometimes we hear, and, debunk this if it's myth or not myth, Jackie, is they don't want to be a burden to loved ones.
Right. So of my little time I spent in this niche, in this type of work, one of the greatest sources of learning we can have access to are from individuals who have survived their very serious suicide attempts. This is an incredible group of people that are showing with great vulnerability, giving access to the mindset and the experience that they are in prior to their very serious attempt that they survive. And often is the case that they report the belief of being a burden to their family. And even you will see this so much be true so much in the way that they're the method or the way that they attempt to take to die by suicide. People will leave their homes or go to different places, or the things that they do to not add an additional burden to family. So that is a common we learn that from those willing to share with us who have survived their very serious attempts.
And that was my stepfather. It was at a hotel. We wouldn't let him come to the house that wedding weekend because he had been using, and it was just he needed to get checked in, but there was no room, beds available. Welcome to California.
Resources.
No, low resources. So we had to put him in a hotel until Monday. Well, my wedding was Saturday, and the housekeeper found him Sunday morning. And that's how we, and then found him out and all of those things. But I know he felt as though he was a burden because he had expressed that from all the stuff that my mom was doing and trying. And I truly believe that he thought that this was the only means that he wouldn't be a burden to her.
Right.
And that's really sad, because a lot of the ones that are going through the mental health struggle of it all, this may be a temporary phase, but in that moment, it feels never ending.
It's forever.
Right.
It seems like it's forever.
And that goes back to that piece about reduced impulse, control.
Mm-hmm.
That's that moment. And that goes right back to also sitting in discomfort. We got to model that. It's okay we got to sit in
we have
discomfort.
To learn how to feel.
Yeah.
We have to
learn
hurts.
Yes.
And heal from it, and not just like, okay, I'm over it. Let me just
make it go away.
Like, exactly what you're saying.
Well,
Jackie,
yes. Sit in it, and then what's your coping skill? Because my stepdad's coping skill was drug use. And even though it was an unhealthy coping, it was his coping. And so when that had its own share of demons attached to it, right, with, started getting to, like voices, and then of course the isolation, and then you'll do well for a minute and then go back to coping. Like I can safely say right now, being a clinician now, is he had no coping skills.
Right.
When it's not hard, because you can feel it, but then what do you do?
What do you do?
Right? What do you do? And it has to be something convenient, viable, ready, on hand, because guess what?
And you gotta halfway like it, folks. We cannot be telling people.
Yes.
Look, I'm just about to make a whole bunch of
I ain't mad, because you know how we do. We real clinicians.
Because I'm about to say nobody wants to.
Okay. What they say, 100%? Oh, just 100. Okay.
I'm just going to tell you, not everybody wants to go home and journal it. Okay.
That part. That part. Exactly. Exactly. And then let's say the panic attack happens in the middle of Walmart. You don't even have access to the journal. Right. So what is something within your toolkit that is accessible, convenient, readily, and can bring you down when you need to?
It's got to fit in your pocket. It has to fit in your pocket. It has to. And, one of the best things we can do is to start that earlier. It's like Brittany's talking about, that early inoculation, talking about this stuff, like making it okay to, and this gets cheesy, and I'm 100% fine with this, is talking about our feelings and being in a funk about it. Like, it is okay. Like, that's a normal, but
again, you
really feel when somebody asks you, like I don't love to throw people off, but I always kind of get a kick out of it. If I'm in the drive-thru, I'm somewhere and I'm not having a good day or moment at the moment. They're like, hey, how are you? And I'm like, I'm not my best right now.
Yes.
And they're like, and And I'm like, I'm sorry,
Yeah.
which really I shouldn't be
Yes.
apologizing because you asked me how I was doing,
Yeah.
but just really normalizing, like, just say
Modeling
how
that.
you feel. It's
Yep.
okay. Like, we
Yes.
all feel, when your mind starts to wander, and it's not like wondering, like, oh, I'm wondering what I'm going to eat tonight. It's like wandering over there, up
Yeah.
there, way out there. That is not, oh no, I've been
Yeah.
there. That's not a good feeling. So, like, you
Right.
got to figure out what you can do in a matter of minutes, moments, and if journaling and counting and working out and finding something red and finding something that's gold to touch or whatever doesn't work, like, learning that and having education of it for 5 years, boom, you're gonna have something. Just like
Yeah.
we know what to do when we gotta, write our bills. Okay, let me get my receipts, yada yada. Why? Because we've had practice doing it for
Yeah.
so long.
Exactly.
And the point is that practice needs to happen when you're not in emotional
crisis.
reactivity.
Yeah.
Yes.
And which kind of brings me to, if you are having suicidal thoughts, and I just want to read off this list here, is if you yourself, I'm not talking about what you can do as a peer or friend or other, because you don't know when. It could be you're at the bus stop. It could be your colleague. It could be someone you just randomly ran into. But if you yourself are having, take it seriously if you're having the thoughts. If they're coming back around, and it's very different from, oh my gosh, I just, a draining day. We're talking about you're seriously having thoughts, take it seriously. Treat it as you would, as Brittany said, like you're having some physical symptoms, as we're all saying, is just another part of the body that you should get checked out. And don't try to go through it alone. That is the biggest thing. When I was hearing about survivors, not the family members, but actually the ones who survived an attempt, they were saying when I was alone, one lady said the voices would get louder when I was by myself. And matter of fact, tell me to get alone.
Mhm.
And because then you have no one to kind of break it up and encourage it and stop kind of like that narrative and that pattern from going. So it's just you and those really, really kind of self-hateful thoughts, right? Because they're coming from a place of fear or hate at the moment. And when you have someone who can empower and encourage and motivate you, you can kind of stop those thoughts from rumbling around. Go to a professional. Your cousin is not your therapist. I
No,
mean,
ma'am.
I love the fact that, and listen, if my cousin's list, she was like, yeah, she is. Because she does say, my cousin is my angel and guided me through my judgment. So I'm not saying don't go to someone that can encourage and support you. But when you need the help, you need to get that professional help. And that goes for anyone, even if you are a therapist, because the therapist got therapists. I tell people that all the time. Doctors see doctors. I don't see doctors perform their own surgery unless they got to, like they on Survivor's Island or something. Otherwise, they're going to see a doctor to get
Absolutely.
their care.
Yeah.
So please, even as clinicians or people in the field, and we see a lot of helping professions struggling.
Yeah.
Your police, your nurses, your doc. Right now, what's going on? Burnt out, fatigued out, vicariously traumatized out. And so they need to get the help too, because none of us are out of the loop of a mental diagnosis. I say that all the time. And or thinking something may be better if they just weren't here. So we need to check in even with our professionals. Talk to others who can offer support. Obviously, if you are really close to someone, and again, it's kind of like I told my kids when they were younger, some secrets we don't keep.
Right.
And that may need to look like kind of the question I asked about the help. What should this father have done? Well, guess what? If he's unwilling to go because of an adult, will you bring help to him? And that looks like 9/11.
Yeah.
That looks like coming to do a welfare check. That looks like, guess what? You know what? I'm not convinced you're safe. You're going to get evaluated. And so we would much rather them dislike us for that moment than to have, what did you call it earlier? A preventable loss, right?
Yeah.
And so choose people you can trust. I'm not saying don't talk to a clergy, a pastor. I'm not saying that, because that may be helpful for you. But I can tell you with my stepfather, he was in the church. He was a deacon. He did prayer. He cooked for the church. He did all those things. He was still in darkness. So I want to today say that. And I would say we've gotten better in some churches, and I would say in some cultures, but we are not there yet as mental health and church meets. So we need to get good about that, because there's the stigma of, if I go to my pastor or my priest or my whoever, what are they going to think about me and my family? And then avoid alcohol and other drugs. And then if you are a friend, if a friend talks about suicide, listen closely without judgment. This is so huge.
That's that piece. We can't.
That is that piece. Yeah. Yeah. Stay calm, because again, sitting in discomfort.
You're
right?
modeling it.
Yeah. And treat the talk seriously. Show by your tone and manner that you're concerned. Acting like you'll get over it, you're just drama or whatever, that does nothing to help the person feel confident about getting that help. Acknowledge the confusion and pain your friend feels. They're not in rational space at the moment when they are thinking that way. So I'm not saying validate, we're saying acknowledge, right? We're bringing awareness that, gosh, that must be difficult, that's an option, or whatever you need to do to get them comfortable enough to say, hey, how about I go with you to the emergency room? How about I go with you to that appointment? How about, you know what, I will make the call. And I actually did that this week for a young person, 18 years old. I sat in my office and we made that call together. It is okay to do that. Encourage your friend to seek professional help. If the person's in danger, don't leave him or her alone. That is the last thing. I was watching a YouTube video of a woman, and she said she had got a bad grade on her test, young freshman year of college. She's never had a bad grade, and it confirmed that she was a failure, something she's thought about herself all her life. She calls her stepmother to say, I feel like killing myself. Where's my dad? He was busy. I feel like killing myself. She goes, why are you calling me about this? And don't you dare call your dad. So she goes, gets a gun, finds a gun, gets the gun, has it in the back seat over a jacket. And I paid attention to what she said, although the interviewer didn't really elaborate on that. She said, I covered it somewhat with the jacket, accidentally exposed it, but not. So she wanted this friend to see it. And the friend said, what are you doing? And she's like, oh, it's no big deal. The friend said, let me just hold this for a little while. And then we go get checked out. And she allowed her friend to do that. So we don't want to leave them alone. Of course, tell a professional and get support to take care of you as a friend. You know, sounds like Brittany just jumped in the way of advocacy. That was her healing. You know, some healing doesn't always come from sitting and talk therapy. Some healings, like, I'm getting in this and I'm going to be an advocate. I'm going to learn as much about it. I'm going to be in the field, whatever that looked like for you to get connected, to get your own healing over these years. Because now you can sit here and talk about it in a way that empowers and helps other people.
Some of the incredible research too with Dr. Frank Campbell, and I know we're past, but I got to say this. He talks about the healing timeline that survivors experience, and often is the case that survivors of suicide start out as a victim. It's a victim mentality. They are a victim of their loved one's death, right? Mm-hmm. They're a victim of the sudden and traumatic loss. And then some time goes on, and with access to help and access to healing community and supported network, you can then become a survivor. You're a survivor of your loved one's loss. And then some more time goes on, and some more healing, and some more access to professional help, and incorporating into your support network. Then thriving happens. And then more time goes on, and the timeline, looks different for everybody. And then guess what's after thriving, Brittany? Altruism. And that's when, that's kind of like the lighthouse. That's when you're shining now to other people in rocky shores. So you're right in that trajectory. You're right there. You're in that sweet spot, Brittany. And Devondre, we could even use that analogy on your time of healing too. When we travel those steps, and he uses it like balancing stones from victim, survivor, thriver, and then into altruism. Then we take those lessons from our loss, And now we're helping people get to safe shores, because that's the next best thing. That is the opposite of that silence. That is the opposite of the perpetuating stigma. That's the antidote. That's it. That's what we got. And both of your stories really like prove that model that he talks about for survivors. And it's a good thing to have platforms like this to help others see where they're at in their own journey, and then to get to the next step of their own healing.
Yeah. Yeah, Trina says, I have 3 other therapists. Yes, you are not a stranger to accessing help, and that is beautiful. And I love to be a part of your journey, because the good thing is, even though I'm a therapist, like I get to be your cousin and just kind of like keep it real, whether she likes it or not.
No.
The other part too, and we didn't touch on this, and I won't go back because that might open up a whole nother 45 minutes. Which I'm game, but I know people got lives, is sometimes, but I would be remiss not to say something is sometimes is, when the thoughts of suicide are there, sometimes it doesn't look like people expect it to. It doesn't look like this doom and gloom. And so this is where you get folks, right? You get folks like, well, what happened? He seemed so happy then. And there's kind of like the switch that happens, right, Jackie? There's a
right.
That's contentment with the decision.
This is huge, and this is a big part of that, part of the kind of stigma attached to this, and the confusion that, and this, the mystique around suicide. There's a lot of mystique, and one of those. There's several, but one of the big ones is oftentimes folks, when they have come to terms with their thoughts and they have created a plan, we will see and experience in them a sense of relief.
Mm-hmm.
So then we are almost being presented with, you know what, they seem like they're doing good, or good.
Mm-hmm.
Look at that. Look at him. She's doing great. 2 weeks ago, I also a recent doctor's appointment. This one always shocks me. And everybody's always biased. As a therapist, you're biased to the modalities you like, you're biased to the treatment methods all of those things were biased. And this is one of those statistics that I always leaned on and was always like, what? Recent doctor's appointments. That to me challenged my kind of stereotype of someone who was contemplating suicide. In my mind, I was thinking, they're not going to doctors, they're done. Mm-hmm. They're not. But recent doctor's appointments, those are on the list. So I always like to share those with folks who mm-hmm. are learning or curious about prevention and becoming empowered with stopping the stigma and the silence, because those challenged me. I always was like, what? Mm-hmm. You will see someone present with like a euphoric release because they have a plan, and then doctor's notes. Right. So those are always interesting to me.
Yeah, I wanted to make sure we mention that because again, there's that, as you call it, mystic piece of it. It's just not this straightforward thing that we can just kind of sit here and say. No. I so agree. As a new business owner, I'm struggling. Well, I would definitely tell you, if you're, and I don't know defining struggling. So I want to make sure that, if you're someone on here and you are struggling with thoughts of suicide, we're here to help, and we want to definitely leave a resource.
I always want to leave the National Lifeline too.
Please.
This is I don't know. I'm still a little bit granola. So even through COVID times, I do not have my technology down. But if I type it over here in the chat, is that?
Yep.
Okay. So this is the National Lifeline right here. And this is just a tried and true, trusty space. Another kind of perpetuating piece of suicide and suicide prevention awareness is that sometimes we feel like when we do raise our hand, or when we do reach out for help, or if we do demonstrate help-seeking behavior, that it's this cop cars coming with sirens blaring and white straitjackets taking us away, and all of our worlds are exposed and my privacy's gone, and it's not worth letting people in to know I'm struggling. And I'm just using the word struggling because that's where we left off. But the reality is the response to a suicide risk is quite subtle and is more helpful than it is. In fact, it can be quite frustrating for loved ones who are looking for that big response. It can be subtle, and it can include folks agreeing to terms of their own safety and terms of keeping themselves and making plans. It does not mean that your life is now upside down and that everyone is aware that you were not making it work. Like it looks different. When help comes, it looks different. It's not like it looks in the movies or in the books or in the songs. It's not like that.
Exactly. Thank you, Jackie. And thank you, Kalish, for clarifying. She was saying, no thoughts of suicide, struggling to scale my business. I believe this is due to outside stressors. And that's kind of how it starts, right? It's this outside stressors. And then how we internalize them definitely plays a huge part in how we move forward. And it's impacting everyone. Jackie said, you throw in the pandemic on top of already having just being a partner, being a wife or a husband, and trying to make ends meet or whatever that looks like for your life. And then how do you perceive that, right? What's going on here? And venting that out, right? Having that safe spot to kind of land on before it gets and grows. And sometimes when it gets and grows, it doesn't mean that the outcome will be suicide. It may look like the outcome becomes anxiety or depression, right? It can look like burnout. That is listen, burnout is real.
And another common thing too is like just in general gastrointestinal health, just in general, that just classic stuff that people IBS or all those that we the healthy a healthy gut and that feeling in your belly, all the little sayings around that are for a reason. It's real. Those things we are really good, you guys. I'm going to take it back to where I was going with what, the type of culture we live in. We are really, really good at doing anything we can to protect and show that we're strong and we got this. So our bodies will start to take any sort of any of our mental health symptoms, stress, anxiety, anything in those, and we can actually have physiological manifestations of that. Things become physiological before we will get to a therapist. I will let a doctor do all sorts of tests on me before. We're real good at that. So just being mindful of those things.
People don't think that our brains function, our body's movement, and how our bodies function.
Right.
So you just really hit the nail on the head because
we
always have to
when I was in Kings County, one of my managers, it was a mod actually, D, and we would have some wonderful conversations, and they were not always business appropriate. And I think that's why our team was great. But one of our favorite things we used to say is you got to get that checkup from the neck up. That's just, like that's, and we worked with youth. So we tried to normalize that with young people and,
this is so good, ladies. I mean, we put in the National Suicide Prevention Hotline. Jackie was able to do that. And then I put the Veterans Crisis Line, which is the same as that, but just press 1 or text. If you are local, I believe the loss team information, local meaning Kings County, they do have
the other one for Tulare, the SPTF one too.
Okay. Yeah. Okay. Let me get that because for some reason it's going in private chat. So I'm just copying and paste. That's okay. I got it. So we want to give you all the information that we can give. And even if you write it down for someone else, we don't know where you'll be, when you'll be, and you have these at your fingertips. And so take a picture of it If you are in Kings County, I will put that number as well, 852-2975. I don't know if that belongs to, but it's going out. And
we have the warm line too. Let's see.
yes, can you go ahead and just explain the warm line, Jackie, so they can know the difference between that and the crisis line?
So the warm line is another number that you can call when something's not quite right, and it's not a crisis, and you still need someone to talk to that's going to sit in that space with you from a non-judgmental perspective. So the idea with that is it was born out of that idea was the warm line. And let's see, that one.
I may even have it here too. I think I have it, Jack.
Okay.
1-877-306.
And that's a collaborative with both counties too.
Okay, perfect. I'll put that in the chat as well. So, having someone on the other end that may not be as clinically professional, but is there to have that conversation with you.
Yeah, there's nothing like the lived experience. Letters behind your name are great. And they're great for being able to open doors and do things for you. And there's nothing like the lived experience when someone is in their moment. I've been welcomed into many homes where loved ones in people's death scenes, and loved ones are in their darkest moments of despair. And I can't tell you how many times someone's looked at my face and asked me if I've lost someone to suicide. They don't care what kind of expert or 10 years, whoever taught me whatever. They want to know, have you felt like I feel right now? And the warm line gives you that.
Awesome. Well, we're giving you all some great resources, local. And when we say local, I understand there may be a couple folks that I know are looking from the East Coast. So I want to be very specific that some of these local ones are for Kings and Tulare County here in Central Valley, California. And the Veterans Crisis and the National Suicide Prevention is for everywhere. So just take the number and, have it handy. I'm not saying that, I hope you don't run into anyone who needs it. But in the event that you do, you have some information. You can say, you know what, I remember there's a National Suicide Hotline that they can call. And if you don't know that, just 911. 911. They should be trained, right, to be able to go out and have kind of like that. At least they are capable of, retaining someone to make sure they're evaluated. But in addition to that, to getting them evaluated to make sure that they are not a danger to themselves or others is huge. And so if nothing more, you don't remember the line, but you think a friend, family, or loved one is actively have a plan, they plan on carrying it out, or they're in the midst of, do not hesitate to call 911. Do not hesitate to do that. And so if there's anything you could leave for our guests today, ladies, what would that be? Brittany, I'll start with you. What would you leave with our guests based on everything we just talked about?
I'm going to have to say, I tried to put it in the chat, but then I kicked myself out. So I'm just going to say it. Thank you, Jackie, for sharing. Just get a checkup from the neck up.
Mm-hmm. Love that, Brittany. Love that. I agree. I'm biased. I love mental health awareness. I love having hard talks. So if I could say anything that people take away from this, being able to develop and practice your comfort level with having difficult, direct talks around suicide would be a great takeaway from today. Just being able, if you have the fear, you have the concern, grow some comfort in directly talking about it.
I love that. And I will add on top of both of those comments, I would add, start early. It is not, early intervention and prevention is far cheaper than intervention and is far more helpful. If you are struggling to have a conversation with your children around suicide, what that means, how to say it in an age developmentally appropriate way, we have access to Google, we have access to YouTube. Look it over, because I'm telling you, they've heard it. They've probably even seen some interesting things. It's kind of like the sex talk. You think you're creeping around, and by the time you try to have it at 12, they're like, Mom, really?
They're not.
We're full on over here. We know. Beep, 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 beep. Right? So it is not too early to talk to a 5-year-old about big feelings, because they're feeling it anyway.
Yeah.
It's not too early to talk about coping and breathing, taking ourselves from the sympathetic nervous hijack to a parasympathetic. I mean, like, look for those things that you can start doing at an early age. There's so many books out there on emotions, how to feel, how to express, how to be responsive. So if you don't know how to speak to your children or a loved one, maybe it's an adult, about suicide, I would tell you to look up things. They're available. Go to some of these websites I put in that Jackie gave us. I was just on afsp.org 2 days ago. There's great information on there. If you want to look up just Suicide Prevention Month, you can Google that in general, and you're going to come with oodles of information. But if you have a young one in your home, it's not too late to start that conversation. You just may need to tailor it. So
I'm about to have 2 young ones come up in here. So
okay, well, I want to thank you, ladies, for being on tonight. Thank you all for your comments and your questions. It was great. Have a good one. Until next time.
Thank you so much for providing the space. Thank you.
Absolutely. Thank you, ladies, and God bless. Take care.
Bye, y'all.